everyone. So now we are going to look at radon exposure and its clinical features with some presentations as well. Radon is second leading cause of lung cancer after smoking, and radon exposure has no other risk factor. And a clinical feature, clinical presentation is non-smoker with chest heaviness, cough, hemoptysis, diagnosed with lung cancer. This is because of radon exposure. An old man with non-productive cough, blood sputum streaked, bilateral V's, chest X-ray shows 5 centimeter hilar mass in the hemorrhagic in pleural cavity. Hemorrhage in pleural sputum shows pleural effusion. Sputum shows echo hyperchromatic pleomorphic pleomorphic cells with scanty cytoplasm is because of radon exposure. Another clinical presentation is a patient with 5 month history of a patient with 5 month history of cough with sputum, right lung, expiratory V's, X-ray shows small peripheral lymph node, biopsy shows squamous cell carcinoma. That is because of radon exposure. Now the next one is asbestosis. Asbestosis has lower lobe lesion in plumbers, especially 5 centimeter opacity of left lower lobe of the lung because of asbestosis exposure. It can also lead to carcinoma and commonly caused by asbestosis is bronchogenous carcinoma. Asbestosis patient working in demolition of old buildings having dyspnea, chest X-ray shows diffuse interstitial fibrosis of lung and iron stain. D string and beads seen. String of beads are seen in asbestosis. Men working in construction company, cough, shortness of breath, chest X-ray, neural plaque, asbestosis, and it is also a carcinoma. And another clinical presentation is patient working demolition buildings having chest X-ray, diffuse interstitial fibrosis, uh, bilateral history of positive of iron staining, asbestosis. Now pleural mesothelioma is also caused by it. Smoker with interstitial lung disease having pleural plaque is caused by asbestosis. Now, radon is second leading cause of cancer, cause of preferred cause in non-smoker with no asbestosis exposure. Asbestosis occurs in demolition factories are industries like in building demolition, and it is associated with the mesothelioma. Now, you can memorize it as mnemonic of BAM. B stands for bronchogenic carcinoma, A stands for abscessosis, and abscessosis causing mesothelioma. So in this way, you can memorize these terms in BAM. And also radon, which is second leading cause of lung cancer after smoking. So these are the most important clinical presentations which you must keep in your mind.